歡迎各位今日出席有關2019
Welcome to the press briefing on the COVID-19. We have Professor Lo Chung-Mau, Secretary for Health, Dr. Edwin Choi, Controller of the Center for Health Protection of the Department of Health, and Dr. Tony Ko, Chief Executive of the Hospital Authority. Professor Lo will brief you on the changes to the anti-epidemic measures, and then Dr. Edwin Choi and Dr. Tony Ko will respectively brief you on the COVID-19 situation and the Hospital Authority situation. Professor Lo first. Good afternoon. I'm sure you're all very concerned about the anti-epidemic measures today. I would like to give you the latest update and also some changes to the infection prevention control arrangement. Now, the government has always stressed the 5 principles we have as we devise measures to respond to the COVID-19 epidemic. That is, we want to reduce the severe cases, reduce death, we won't lie flat, we want to protect the young and the old, and we have to have measures that would suit people. And also we have to consider measures that will help revive our economic activities and social activities. And also we adopt the principles of science-based and targeted anti-epidemic measures and proper management of risk and citizen-focused facilitation in adjusting our measures. Now we have analyzed data and we will adjust our measures because we want to protect public health and make sure that the healthcare system could function properly. At the same time, we want to minimize the impact on the economy. So we want to achieve the best result with minimal cost. So after 3 years with the collective effort of all in the community, we have seen that we are now much better prepared to respond to the epidemic. And since the 5th wave of the epidemic, many have acquired immunity against COVID-19. Of course, we have seen a rise in cases recently. In a moment, colleagues from the Center for Health Protection will update you on the latest situation. It seems, though, that the figures are going into a plateau, especially in terms of sewage surveillance. We see that the recent surge has plateaued, and there are also some signs of a declining trend, but still we will monitor very closely the situation. Most importantly, colleagues of the Hospital Authority and also the private healthcare sector have worked closely together. As a result, we have made some major progress in maintaining our healthcare services. Now, for the number of daily cases now is actually higher than that in August or September. We have recorded 4 times more of viral load in the sewage surveillance compared to the last peak. Still, with the effort of colleagues, we are still able to maintain services in the public hospitals. And in particular, apart from an emergency service, we are able to maintain a good level of non-emergency services. You might recall in August or September, we had to trigger level 3A of our emergency response plan. So many more people were affected, especially at one point we had to reduce non-emergency services by 40%. But now we've gained an experience, and also we have adjusted our anti-epidemic strategy. So colleagues of the Hospital Authority are able to be more flexible in making various arrangement and deployment. And also we're working closely with residential care homes for the elderly, and so we're able to reduce the number of patients. So apart from maintaining emergency service, we've been able to maintain non-emergency services, and we're still at a level 2 of our emergency response plan. And so there's been no major impact on public healthcare services, both in terms of emergency and non-emergency services. And that's very important because the first foremost target is to ensure healthcare services are at a normal level. Only then we're able to allow more economic and social activities. So on the whole, we will eventually return to normalcy. This morning at the press conference, the chief executive announced some new anti-epidemic arrangements. The chief executive mentioned 2 points this morning. One, removing the requirement to scan Leave Home Safe app, and 2, to remove the yellow code. I will elaborate on those measures. There are 3 other measures to be announced, and I will explain the details to you and also give you the rationale for making the adjustment. First of all, removing the requirement to scan the Leave Home Safe app upon entering certain premises. Since November 2020, the Leave Home Safe app was launched. It plays a very important role in our whole fight against the epidemic. First, it is a convenient way to record movements of the public, and when there are cases, then we could help the public to identify high-risk activities, and it also facilitates contact tracing. So it's played a very important role, in particular in contact tracing. But then in the light of the development of the epidemic, we believe that we could remove the requirement to scan the Leave Home Safe app now. So we will revoke the relevant legislation requiring the scanning of the Leave Home Safe app. As for venue operators, they no longer need to post up the QR code for the Leave Home Safe app. This policy will start from tomorrow.
We also want to emphasize that the vaccination passport is an important policy. On one hand, it can encourage the public to get vaccinated. Especially, we need to emphasize that our vaccination rate has been at a low level. The vaccination passport policy can also protect people who have not been vaccinated, especially the elderly and young. So we don't want them to go to high-risk areas and be exposed to infection because it would be detrimental to their health. So therefore, the vaccination passport policy will remain intact. That means members of the public who enter premises, they need to display their vaccination records. So this is not linked to Leave Home Safe app. Now, of course, the members of the public can rely on their smartphone apps. On the lower right-hand corner of Leave Home Safe, there is a vaccination record function, and at the same time, members of the public can use I Am Smart app, the app, to display their vaccination records. So for inbound tourists, they can also get a temporary paper-based record. Some elderly who don't have a mobile phone but have been vaccinated, they can receive a paper-based vaccination record and enter premises that need these records. They can also rely on a smartphone picture to display those records. So there are different means where they don't need to scan the Leave Home Safe QR code and still enter these designated premises. The second point about repealing the Amber Alert arrangement. Now, the Red Amber Alert on the 12th of August, in light of the pandemic situation, it was one of 2 policies. The Red Alert was for infected persons They could be identified through this red vaccination record, and we could identify these people, especially when we can't prevent them from. We can use that arrangement to prevent them from entering high-risk areas. Now, for inbound tourists, it's also a way to identify them. So, as we have been fine-tuning our inbound tourist arrangements, so in our two-step process, we now have designated venues such as hotels or residential homes that can be used as quarantine facilities. Now this policy has been scrapped. So in other words, starting from 26th of September, we have lifted all restrictions for hotel quarantine or home quarantine for inbound tourists. So when tourists arrive in Hong Kong, they can conduct activities in different areas. Now, starting from 20th of September, we had a 3-day amber alert arrangement, and looking at the recent months' figures, tourists arriving from overseas and Taiwan, the number of infected cases is about roughly 3.8%. That is, for 1,000 inbound tourists, there are 38 cases, positive cases. The majority of these cases were identified at the airport, and this ratio is about 2.2%. So after testing and releasing, after doing the PCR test at the airport, when the results are provided, so for 1,000 tourists, only roughly 16 tourists are positive cases. So this 1.6% ratio, compared to community testing of 2.5%, it's even lower. So after scrapping the inbound tourist restrictions, we've noticed that the inbound cases have been increasing because we have more tourists now. Roughly a daily figure, we have some 200 cases, and now it is about 800 cases. But the rate of increase is stable, and in the imported cases, they make up less than 10% of total infections. So the daily average, it's about 5%, the daily average. So in light of this, in order to balance our economic needs, and we all want tourists to have a convenient stay in Hong Kong, so we scrapped Taiwan tourists and overseas tourists who to have a 3-day amber restriction. We've lifted that restriction. So once they arrive at the Hong Kong International Airport and they conduct a PCR test, subsequently, according to current requirements, they need to do another PCR test on the 2nd day and a rapid antigen test on the 5th day. So the inbound tourists, after arriving in Hong Kong, they don't have any restrictions. So the same day that they step off the aircraft, and according to the test results, they are free to enter different premises, including restaurants, bars, museums, theme parks, and so on. So aside from the 2 points that were raised by the CE this morning, aside from those 2 announcements, there are 3 additional points that have been fine-tuned. So these 3, the first of them, we will scrap tourists traveling to mainland and Macau border control, that is Shenzhen Bay border control airport, and we don't require them to do an RAT test anymore. So this is also in line with the mainland policy. Now, originally, Hong Kong government in March this year, in light of requests from mainland and Macau, so tourists headed towards mainland and Macau, they needed a 48-hour negative PCR test, and at the airport and border control, they also needed to conduct a RAT test, and they had to wait for a confirmed negative result to continue their itinerary. Now, we understand that this arrangement is inconvenient for tourists heading back to mainland or Macau. Now, in light of mainland's fine-tuning of its policy, especially with the 20 requirements, the recent 20 requirements, starting from tomorrow, we will scrap the special PCR test requirement. In other words, tourists traveling to mainland or Macau, they only need to comply with their relevant requirements. That is, they need a boarding pass, or they only need to have a negative PCR test in 48 hours. So they don't need to conduct a special PCR test at the airport or border control point, and they don't have to wait for that result. Another point, another adjustment we have is the PCR strategy for the community. We need to deploy our resources more accurately and in a more focused manner. We have to target high-risk groups.
First of all, on compulsory tests, we will continue to target places with a major outbreak, but then otherwise we will reduce the reduce the frequency of issuing community compulsory test notices to residential buildings. Instead, we will be distributing more RAT kits. And then for specific industries, we will also, right now we require the staff to undergo PCR tests, but then in the light of the epidemic, we will narrow the scope of targets that need to undergo PCR test. We will just focus on the high risk and vulnerable groups, that is staff of the hospital authority and residential care homes for the elderly and the disabled. They will still have to undergo regular PCR tests because we want to protect hospital patients and home residents. For other specified groups, they no longer have to undergo regular PCR tests. Instead, we will leave it to staff to carry out RAT regularly, and if there are positive results, they should declare that. As for students, RAT, we will keep that arrangement for the time being. The last change is to remove the requirement for for persons in home quarantine and isolation, or in home isolation, to wear the electronic wristband. Now we have the red code in place. That is an effective measure to prevent certain persons from entering certain premises, and that is an effective means in lowering the risk of community transmission. Starting from July, we have again imposed the requirement of wearing a wristband. And that approach is not so cost-effective when there's an increase in the number of confirmed cases. So that's why we believe it's the time to remove this requirement for wearing a wristband. Instead, the government will send the anti-epidemic packs to those in home isolation and quarantine. They will also do random check to confirm if any such persons have left their designated quarantine or isolation venue. Now, on the whole, we are making major adjustments to our anti-epidemic measures as an important step towards the returning to normalcy. We have proposed these 5 changes, but then the emphasis is still on protecting the high-risk group, especially the old and the young who have not completed their vaccination. We will have balanced the risk of the epidemic and the need for allowing economic activities. I must stress again, we must still wear the mask, especially because it's winter. this is a season when the COVID-19 virus is more active, and also it is the seasonal flu period. So we hope the public will remain alert. They must wear their masks properly. More importantly, people must get vaccinated. For those who have not completed the vaccination, please avoid going to high-risk venues. And for those in the high-risk groups, they must still use the PCR test as far as possible. And for others, they could take RAT. Finally, I would like to thank all healthcare personnel in Hong Kong, in particular colleagues in the hospital authority. Last week, I visited 3 public hospitals. The United Christian Hospital in the Kowloon East Cluster, Characters Medical Center in the Kowloon West Cluster, and the Prince of Wales Hospital in the New Territories East Cluster. Now I could see that while the epidemic is still around, colleagues, and especially in the accident emergency ward, are under immense pressure. Many of the patients, we have seen the number of patients increased for involving COVID and other diseases. So even for the medicine ward, colleagues are under immense pressure. The occupancy rate often exceeds 100%. So on behalf of the Hong Kong SAR government, I hope also the friends of the media here and members of the public here will appreciate this. When there's an epidemic, our healthcare staff are under the most pressure. As we try to return to normality, our healthcare staff have contributed much to that. So as we move in that direction, we hope that we will move in the direction in a steady pace. And now the Christmas is just around the corner, Christmas and New Year. So as we celebrate the festival or the festive seasons, we must still take steps to protect ourselves and our family members. Thank you. Dr. Chui, please. Thank you, Secretary. I will report to you on the number of cases in the past week later. You can see from this chart, in the past 7 days, from the 7th to the 13th of December, on average, we have 14,000 cases or so in a day. And compared to the previous week, there's an increase of 44%. But then in this week, cases around 11,000 to 14,000 cases. So it seems that we are reaching a plateau, but we'll still closely monitor the figures. For cases found, most are locally acquired cases. So that's why the number is more or less as what I've reported. That is, in the past 7 days, it's around 11,000 to 14,000 cases. So that's an increase of about 46.3% compared to the previous week. As for imported cases, they account for about 9% of all positive cases every day. So in the past 7 days, there are 647 to 798 imported cases. The average figure is 718. Compared to the week before, there's an increase of 13.1%. Most of the cases are actually detected on day 1 of arrival. For the remaining cases, they are detected from days 2 to 7. Now, for most of the, so there are about 4% of arrivals who tested positive. And as for death cases, in the past week, there's an increase of 49.5% with 166 cases reported. Residential care homes in the past week, there are 130 institutions with cases. That's the residential care homes for the elderly. It involves 219 residents and 34 staff members. Compared to the week before, There's an increase of 40% in terms of the number of institutions. As for residential care homes for persons with disabilities, 74 homes have seen cases involving 98 residents and 10 staff members. There's an increase of 72% compared to the week before. As for schools, we are still doing, we're still requiring RAT every day. So in the past week, we've seen 9,969 cases involving students and 1,835 cases involving teaching staff. So that's an increase of 38 to 48% compared to the week before. Now, if we see many cases in school, we will require certain classes to be suspended. So in the past week, 145 classes have to be suspended, involving 118 schools. Now, we are very much concerned about the trend of subvariants. Now, for local cases, so far, we have found 145 BQ.1.1 cases and 131 XBB cases. Imported cases, 38 BQ.1.1 and 226 XBB. Now, for Hong Kong, the predominant strain is still BA.2.2, BA.5, so about 60% are BA.5 cases. As for XBB and XBD, that is still just around 1 to 2%. For sewage surveillance, in the past week, we have seen high viral load in previous weeks. But for the past week, we have seen a slight decrease in the viral load found. Still, it's at a high level compared to earlier periods. Global situation. You see that there's a declining trend on the number of cases reported by different countries, but that may be because there are few tests done.
好啦，
So different countries, they report to WHO. So between 14th to 20th of November, 70% of cases were BA.5, half of them were BQ.1, and 10% were BA.2, and half of it was XBB. So to summarize, our locally acquired cases is slightly higher than last week, but we see some situations such as the sewage. It seems that the local rate is plateauing. The imported cases, they make up some 4%, and the proportion of inbound travelers it's remaining at 5%, and we're keeping an eye on the subvariants. Dr. Ko, good afternoon. Just now you heard from the Secretary, and the HA will coordinate their efforts such that we can return to normalcy. Now, for example, starting from tomorrow, when patients come to hospital, they don't have to scan the QR code. Of course, our colleagues will also adjust other arrangements such as visiting arrangements. We will maintain our services. Aside from taking care of COVID patients, we need to take care of other patients. So last week, we had reviewed our infection protocols. That includes investigating, quarantine, and so on. So we want to enhance our flexibility and deploy our beds more flexibly. We want to make sure that we have sufficient beds, staff, and resources to take care of our patients. So as the Secretary said, through these measures, and through our previous efforts, now even though you've heard that cases are remaining at a high level according to Dr. Edwin Choi, but we're still able to maintain our phase 2 response. So emergency services and non-emergency services are still being provided. Now, for example, last night we had 3,700 plus patients who had to stay in hospital because of COVID, including in North Langtao, including our new COVID centers, and only 2,500 of them needed to be quarantined. So that means the majority of them don't need to be quarantined. And in our new cases yesterday, 442 of them But if you include those who were admitted through emergency, there were 188 of these patients. So you can see from the figures, in the past, we relied on these statistics. So if a patient was infected in the last 28 days, they are included in the statistics. So whether they are, as Dr. Choi said, whether we have fatalities, a lot of patients, they have already, they are not positive anymore, they are negative. So in our future updates, we will focus on reporting cases that are admitted to hospital or serious cases. So in our arrangement, we have done a lot of work. So even though that the number of infected cases are high, but while they're at the hospital, while they are admitted to hospital, they can still receive quality care. So we're working closely with our colleagues at CHP. We are fine-tuning the work arrangements. Now, as of yesterday, we saw that some 4,000 HA colleagues, they were able to return to work. And of course, this is a big boost to our efforts. We can ensure that we have sufficient staff to maintain services. Now, the weather is getting cold. We're now entering winter season. So these measures are very important. We've also added staff and deployment measures to emergency services. So even though we have more emergency admissions, we're still able to maintain normal service. Now, emergency ward has special role to play. So even though they might not be admitted to hospital, they can still receive examination, they can still receive treatment, and they can return home to rest. Our emergency ward colleagues and other colleagues, they work together very closely. For example, they support residential care homes. Now, just now, Secretary said that residential care homes are an important part of our work. So not too long ago, we worked with our outreach, our elderly outreach team. We have to thank the Security Bureau, Social Welfare, the Department. We now have a platform where we can communicate with the residential care homes. So when we discover a positive case, we can have an immediate response. Our colleagues can go to a residential home and treat patients. They can also conduct online counseling. Patients might be transferred to a quarantine, or they could be admitted to hospital, they could be admitted to North Langsao or other quarantine facilities. So this kind of coordination, it requires our effective platform. So even though the number of cases at elderly homes is substantial, we're still able to provide services. So we are also able to deploy our medication. So when a person is tested positive, they can receive medication as soon as possible. Not too long ago, we also strengthened our telephone hotline services. We have a hotline where the public can call up. Every day we receive a lot of phone calls. They need medication and support and so on. So we've deployed sufficient staff. When the public calls up the hotline, there is somebody there on the other end of the phone to help them. We also contact high-risk individuals, that is elderly, those children younger than 5, pregnant ladies, or people with a suppressed immune system. So we can make arrangements by phone. We can contact them directly. If they are tested positive, they can receive support. We also help them make appointments. They can also receive remote medical diagnosis. Now, we've received a lot of calls in the last, and we ensure that they can receive adequate services. Now, we understand that's the elderly, they might not have mobile phones and mobile apps. So our staff make thousands of calls a day, and this work is very helpful. We also have figures exceeding 3,400 yesterday where they received online treatment. We also have public-private cooperation where an additional few more hundred people were able to receive services. As Secretary said just now, we work with the private sector. So aside from referrals to private hospitals, the private hospitals also provide online diagnosis, remote diagnosis. So in other words, that can help us deploy more resources towards our patients. We also have an emergency response team. We monitor the number of beds that we have on a daily basis. And when clusters are under heavy pressure, we can help deploy resources. We can work with residential care homes. For example, in Penny Bay Quarantine Center and North Langtao, we can coordinate the resources and services. So we have different public-private cooperation. So all this can help us strengthen our services, our staff deployment, our medical resources. All this is made more effective. So even though we do have higher infection rates, but basically we're able to maintain phase 2 level of services. For non-COVID patients, they also receive adequate treatment. We can also maintain appointment services and non-emergency services. So all this is very important to returning to normalcy. So before I end, I'd like to make a quick reminder that winter is approaching, temperatures are dropping. Some members of the public might have not completed their vaccination. So we want to urge the public, whether it's the COVID vaccination or flu jabs, that you need to get vaccinated because it takes 2 weeks for the jab to take effect. So if you're not feeling well, aside from seeking medical care, you could also seek private treatment for upper respiratory tract infections. If you have any friends, families, or elderly members, you need to provide support to them because the winter is coming, temperatures are dropping. So we need to take extra care of the elderly and those who need special care. Thank you. So we now are at Q&A.
俾你咪發。
So please raise your hand. We'll pass you the microphone, and please first identify the organization you represent, and please limit yourself to 2 questions, and please be concise. On the 3rd row, the gentleman in grey. On the 3rd row. Good afternoon. Question for the Secretary. So there are new measures announced, and some have said in the online that say that perhaps we could delete the Leave Home Safe app altogether. What's the response? And also for restaurants, do they still need to scan the QR code? Would you consider switching to passive check? And then some have suggested that you may consider reviewing the mask order. So what's your view on that? And then there's also hope that there'll be resumption of quarantine travel. I'm sorry, you have asked 4 questions. Please, let's hear the answer. I think the rule is 2 questions each, so I would like to allow other reporters a chance. So I'll just answer your first 2 questions first. On the Leave Home Safe app, it was launched in the end of 2020. There have been many changes to the app. So far, there have been 40 versions of the app. The Office of the Government Chief Information Officer has made huge contribution in designing this app. And also, actually, the Leave Home Safe app has won an award in the Asia Pacific region on an IT award. For the existing mobile app, it actually carries various functions. And today we're just talking about the initial function of the Leave Home Safe app to scan a QR code. If you get into the Leave Home Safe app, the first page is for you to scan the QR code of a venue. The purpose is for you to record where you've been. And then in the initial stage of the epidemic, the Center for Health Protection did use the app to do contact tracing, and it worked very well. Now, with the evolution of the epidemic, the function of the Leave Home Safe app scanning the QR code of venue is no longer that useful. So that's what we are removing now, the function of the Leave Home Safe app to scan the QR code of a venue. But then the Leave Home Safe app actually has other functions. For example, the testing code, PCR testing code. If you register for the code, then it's much quicker for you to do PCR tests and for free too. You could also include the vaccine pass in your app. Now, the vaccine pass can be uploaded to the Leave Home Safe app, but you could also have paper-based vaccination record or the vaccination record in the EHR app. So for the Leave Home Safe app itself, we will not cancel this app because there are other functions in the app that you can use. But then at the moment there is no legislative requirement for people to scan use the Leave Home Safe app to scan the QR code of a venue. So that's in response to your first question. The second question, you've asked 3 questions. Which one do you want me to answer? You mean, resumption of quarantine-free travel. The Chief Executive mentioned that this morning. The Hong Kong SAR government keeps in close liaison with the country on our joint prevention and control effort. Now, resumption of quarantine travel involves people flow between the 2 places. We will actively strive for resumption. There are now the new 10 new rules announced by the country, and there's no mention of resumption of travel. We are still waiting to see if there are such measures, and we'll keep in liaison with the mainland authorities on that. Now, for the quota going to Shenzhen, there's an increase to 2,000 places. That's a progress in itself. We believe that with an increase of quota places for the anti-epidemic station, that is the quickest way for us to resume travel. But then for other measures, it depends on the adjustments and enhancement of anti-epidemic measures on the part of the country. On the third row, the lady in a white jacket. Good afternoon. Which organization are you from? ... News. So there's no longer going to be yellow code restriction for arrivals from travelers from other countries and Taiwan. There is no entry restriction. Does it mean it's 0+3 now in effect? Well, 0, the definition of 0, different people have different interpretations for the 0 and 0. For us, put simply, now starting from the 26th of September, the government has already removed all requirements for hotel or home quarantine. In other words, arrivals could go to any venues after leaving the airport. Now, of course, before we have the 3 days of amber code restriction, so that means upon arrival they cannot go to high-risk venues, especially that involves the removal of the mask. But now the latest arrangement is that there will no longer be any restrictions on movements in the first 3 days of arrival. So for travelers coming from overseas, once they leave the airport, they can go anywhere. There will no longer be any restrictions on their activities. That's how I'll explain it. Over there, fourth row, the lady in yellow.
So, two questions from RTHK. So first question, can you explain the scientific rationale behind keeping the vaccine pass? Because Hong Kong microbiologists have already said that it should be scrapped because most people can and willing to get jabbed have already get jabbed already. So second question would be about the RIT for schools. You said it would be kept for now. Why? Will you consider dropping it after waiting a bit, or does the government have a timeline for that?
Sorry, I can't hear your second question.
RIT for schools.
School RAT.
The school RAT for students, right. Now, the first question about the vaccine pass, even though our overall vaccination rate in the population is quite high, unfortunately, we still have quite a high proportion of the high-risk group, which means our elderly and the young kids who are still not vaccinated. Now, the whole purpose of the vaccine pass is twofold. First of all, to encourage these, especially the high-risk group, to go for vaccination. The second thing is to protect the high-risk group from entering premises which would expose them to a high risk of getting infected. Now, the high-risk group are obviously the elderly and the young kids. Our vaccination rate in the elderly group, for example, for those who are older than 80 years old, the percentage of people who have completed the free jabs is only in the region of about 63%. So, which means there are still about 37% of these elderlies beyond the age of 80 who have not completed the vaccination program. We know free jabs is important for preventing serious disease and death. For the young kids, for kids who are younger than 3 years old, our vaccination rate, the first jab, is only about 22%, which is very unsatisfactory and I would say very disappointing. And it's an issue of serious concern. Many pediatricians have come out to emphasize the need for promoting vaccination in this group.
Sorry, may I invite Professor Loh to answer questions first?
For your second question, the students' RAT test. For reason I've explained, actually, kids are our issues of concern that we haven't really have a very high vaccination rate for these students. And at the same time, in fact, these RAT tests, these rapid antigen tests for these students have prevented a high rate of school outbreaks during this time when the whole community situation is getting worse. We have a high community infection rate. And this RAT test can effectively prevent school outbreaks. Remember that this is the winter time, and we are seeing not just locally, but internationally, an issue of concern that pediatric wards and including ICUs are filled with patients with not just COVID, but seasonal flu as well, and other respiratory infections. This is happening not only in Hong Kong, but also in the rest of the world, in Canada and US and so on. So we have the responsibility to protect them. So we are keeping it for the time being, at least during this, for the winter surge.
好，下一條，呢邊第四行嗰邊所謂第。
Economic Journal regarding Leave Home Safe. Now, we have scrapped tracking for a while, so why have you chosen this moment to relax? Is it related to mainland policy? So, are we falling behind? Have we been falling behind the last few months? Is it inconvenient to the public? So, the app usage, will it drop? Will it affect its popularity? Second question, on the vaccination pass. Just now, professors had urged the public to continue to get jabbed, but experts have questioned the correlation between infection and vaccination. So you now ask people to get the third jab. Will it be capped at the third? Will you require people to get the fourth and fifth jab? Now, I explained just now that Leave Home Safe, the app, you might feel that it's not very, has not played an effective role, but in fact it is very important. So when can we scrap the app? We have been reviewing the situation. There are a lot of factors at play. Now, I will say there is no ideal moment to scrap the app. You can say it's too early. Some other people might say it's too late. Regarding the vaccination pass, now different experts will have different opinions. So when will we have a sufficient vaccination rate? You might recall initially the experts they had different stances on the vaccination rate in the early period. Some people felt that we could get by with a low rate, but they have been stepping up their estimates ever since. So is the third jab the final jab? Will we need a fourth and a fifth jab? Well, the virus is mutating. So the medical world is searching for a new vaccine. So vaccines are also developing, and when we get new strains of virus, we might have a better vaccine in the future. And we might even need other vaccines. One good example is the recent Omicron variant. Now, all the scientists around the world have been searching for a vaccine, and we've now come up with an effective vaccine to deal with the variants and Omicron. So it can boost the immunity system. So that's why, whether it's the third jab or fourth jab, we will suggest people get this new vaccine. And if necessary, the public can also get the fifth jab. So we don't have a sunset deadline. So these contagious viruses are constantly mutating. The direction it's mutating is beyond our control. The lady in blue, TVB, could you put it in simple terms that scrapping Leave Home Safe, but there are still venues that require scanning the QR code. Now in schools, they might have to scan Leave Home Safe. Now, how will tourists display their vaccination records? Now, they might have a lot of restaurants who will accept written paper-based records. So will you urge the industry to accept the paper-based records on our border control areas? Could we expect good news before Lunar New Year? Now, if we can reopen borders with the mainland, what's the preparation work? Are you the adjustment on this occasion does not affect the vaccination pass. Your so-called no need to scan, well, it would depend on the restaurant to keep records. We're only scrapping the need to scan QR codes for restaurants. Now, as I explained just now, there are different methods to display vaccination records. You can press the button on the app. We have the I Am Smart app. We also have a one-touch app. We can also rely on pictures stored on your mobile phone or a paper-based record. Now, if restaurants don't accept paper-based records, well, this policy has been in place for quite a while. We will keep open communication with the industry. We will see how we can implement the vaccination pass more effectively. Regarding schools, they can accept written records, so paper records. It's to protect students. Now, regarding opening borders with mainland, I explained that. When can we open borders? When can it be more convenient? We are working with our counterparts. We want to see that happen as soon as possible. Some people are spreading rumors on the internet, and a lot of these are just rumors. It's baseless, and so when the public receive these kinds of messages, they need to examine the source of this rumor. So my suggestion is to not forward these false news. Spreading false news would affect our preparation and work. Now, we have been in communication with the mainland. Now, there have been some adjustments on the mainland, so we will have to adjust our preparation work, especially in the mainland's 20 new policy requirements. Previously it was 7+3, it's now 5+3. Next question.
Mr. Low, Hong Kong Free Press. You said in February that we would all die together if we live with the virus. Just this weekend, you said that the tracing app is here to stay. Have you changed your stance on living with COVID? If not, why submit a report agreeing to these relaxations of rules? Also, I have to say there's a lot of confusion still on social media about Leave Home Safe, and I know there's been many questions, but you're saying it's not needed, but we still need to do the vaccine pass, and that it appears some restaurants may at their discretion still require it. Will you clarify to restaurants and to Hong Kongers whether or not they can use perhaps the actual vaccine certificates QR code, and what exactly will be happening tomorrow in terms of what people have to carry around? And will there be active checking? Thank you.
Okay, thank you for your questions.
The virus is evolving and the pandemic is still here. I do not think that we are giving up everything in protecting our citizens against the virus. We are modifying it to adapt to the situation. And I will also emphasize that we are balancing all the measures to protect the health of our people, as well as to ensure that we have enough economic drive. Now, there's no doubt that we have quite a number of our citizens dying from the virus, the infection. But the virus has evolved and is still evolving. We will continue to ensure that we can protect the health of our people. Your second question about the Leave Home Safe and the vaccine pass. I have to emphasize that these two are separate. Some people would put them together. But in fact, Leave Home Safe is an app which can allow you to get the vaccine pass. It contains a number of functions, such as the scanning function, which can keep the record of your place of visit for you, as well as for contact tracing. It also has a code for your rapid access to PCR testing. It has also the function for you to show the vaccine pass. But you can actually show the vaccine pass with different means, including the e-health system. You can also screen capture the vaccine pass, as well as use a paper version of the vaccine pass. These are all allowed. We will continue to communicate with the premises where vaccine passes are required and they have to use it. There is no doubt that the paper version is an acceptable form of a vaccine pass.
The QR code on the vaccine certificate, is this the one you mean? Or do you need a special QR code?
The QR code not on the vaccination certificate, there is a vaccine pass certificate. For example, inbound travelers who comes into Hong Kong, they can get a temporary vaccine pass. And it can come in the form of a paper version. So this is absolutely acceptable. So we should make it clear, the two are not the same. And we don't need to bind the two together.
Just to clarify, there is active checking on the door from tomorrow as usual.
The active checking, the scanning of your vaccine pass remains unchanged. But our citizens are not required to scan anything. The restaurant, bars, or these scheduled premises, they will need to scan the vaccine pass of the client, the customer.
下一條，嗰邊第四行最過嗰位女士。
From Phoenix TV on resumption of quarantine-free travel. What are the biggest concerns on the two sides? And is there any further relaxation of tourist visa? And then in some boundary control points or on the mainland, on Shenzhen, side Futian and so on, they have switched on lights, they're doing cleaning. So are you making similar arrangements in Hong Kong? And, when do you think there will be, some vaccines have been approved by the mainland authorities, when do you think these could be made available in Hong Kong? Now, first, for resumption of quarantine-free travel, whether it's for leisure or for business, we keep in close liaison with the mainland authorities on that. Now, there is news that the mainland boundary control points are all ready. I think you need to confirm the news, first of all. On the part of Hong Kong, we always remain prepared. Now, we've just announced we're going to remove the RAT arrangement at boundary control points, so that means we will free up capacity. And if we are able to increase the number of quota places at the epidemic stations, that will help us to cope with an increase in people flow. As for the mainland vaccines, we are closely monitoring the relevant data. We have been in touch with that company. We've also received some initial data. So we keep an open mind if we could offer the public another option, especially with this inhalable vaccine. No, as a booster, we would consider using the inhalable vaccine as a booster. The Department of Health will study the data and will consider whether to approve the vaccine. On the inhalable vaccine, Dr. Choi, do you have anything to add? Well, this is a new form of vaccine, and we know there is not just one. There's one that is inhaled through the nose, the other through the mouth. But then we have to study the scientific data. We know that the vaccines may be used as the first dose or second dose or as a booster dose. And then there are different clinical data. We have to study the clinical data. And where appropriate, the relevant scientific committee will see if they suit Hong Kong's purpose. On the second row, the lady in purple. Good afternoon, I'm from cable TV. Now, you're just scrapping the scanning of the Leave Home Safe app. Are you still keeping the vaccine pass requirement? Does it mean there's a relaxation of entry requirements to premises? Now, you mentioned the vaccine pass requirement and the vaccination rate. there's some sort of relationship between the two. So have you reviewed the situation? How much more do we have to boost the vaccination rate? What about the effectiveness of that? And you keep the vaccine passes just because you don't want people to see that you are lying flat. And what about mask wearing? Would you gradually relax the requirement so that there's no need to wear a mask outdoor? As for the removal of the yellow code, why don't you just announce it's 0+0 again? Is it because you don't want to be seen to be lying flat or to be in the goblin mode? Well, you've asked 4 questions. Sorry, the first 2 questions then. Please answer my first 2 questions. Now, on the Leave Home Safe app, we've been enhancing it on a continuous basis. And as I've said, the Leave Home Safe app served certain purposes in the past, but now we believe it's time to remove that particular scanning purpose. It's just about scanning the venue code. As for the vaccine pass, how would it affect the vaccination rate? We can't just look at recent figures. I hope there will be a scientific way to consider it, because for this whole vaccination process, now, at the beginning of the year, our vaccination rate was less than 10% for the elderly group. And now we're able to boost the rate as a whole. Now, I did say that the vaccination rate in the elderly group is still low, but then it's been a great improvement since the beginning of the year, and the vaccine pass played a very important role there. And now, at this point, how much would the vaccine pass influence the vaccination rate? Well, if some experts are interested, they could study that. But it's not just for us to come to the view that it no longer serves any purpose. That's the end of the press briefing. Thank you so much.
我哋記者會結束咗啦，唔
That's the end of the press briefing. Thank you very much.
我搭埋口罩令。
Okay, I'll answer your question on the mask wearing order. The mask has been a very important element in our whole anti-epidemic strategy, and it's not just for preventing COVID-19 infection, but also influenza infection. You could see in the past 2 years during the influenza season, we have seen a low level of cases of influenza. That's because of the mask. And then now this year with the winter here, many experts have said because COVID is still here and Omicron is highly transmissible. Now, we are all wearing masks, but still the transmission rate is so high. That's why we see an increase in the number of COVID cases. And also in the past 2 years, because we've been wearing masks, so our immunity against the seasonal flu has been lowered. That's a cause of concern. So that's why I would like to appeal to people to get the influenza vaccine in addition to the COVID-19 vaccine. And I hope that this winter we will all stay alert and we'll keep our masks on. And with such protection, then we will be able to resume other economic activities to a larger extent. So I hope you will all support these measures and policies. Then we could protect ourselves, we can protect our family members, and we'll make sure that our healthcare system will not be undermined. Thank you.